We will wear the gloves. Gloves are new, not reusable, but disposable gloves. So first of all, we will wear the gloves. At second point, we will wear the face mask. At third point, we will wear the goggles or eye protection. At fourth point, we will wear the booties. Let me show you what do I mean by booties. This is the shoe cover. Shoe cover. This is called as booty, and this is face mask. So first of all, considering clean to dirty, first of all we will wear the gloves. On second point, we will wear the face mask. On third, we will wear the goggles. And fourth is booties. Booties is an exception because booties are new, but we are putting our foot on the ground. That's why we will consider the booties at last point. So great, we are done with the first stage. First of all, we will sanitize our gloves. Now our most dirtiest thing is the booties. We will remove our booties, our shoe covers, and again we will sanitize our gloves. Then we will remove our goggles, our eye protection. Again we will sanitize our gloves. Then we will remove the face mask. Again we will sanitize our gloves and remove our gloves. And again we will sanitize our hands. Remember, while doffing, we have to sanitize our gloves, our hands between each step, before and after each step. Sanitize our gloves, remove booties, sanitize gloves, remove face mask, goggles, sanitize our gloves, remove face mask, sanitize gloves, remove gloves, then sanitize our hands. This will limit our infection to touching while we are removing our face mask. Sanitizing our glove will limit the infection and will not go towards our mask. So while doffing, we have to consider the dirty to clean from red to green area. Booty is the most contaminated. We will be doffing the booties in the red zone at the end of the red zone. Like you can say there is a line, the red zone, here is the red zone, here is the yellow zone. We will be standing here. We will remove our one booty and put our foot on yellow zone. Good. Then we will remove the other booty from the other foot which is on the red line behind the yellow zone. We will remove those booties, and then after removing the booty, where we will place our foot, we will place our foot in the yellow zone. While we are wearing booties, we are here, the line between red and yellow zone. While removing first booty, we will place our first foot in yellow zone, second booty, and place our second foot in the yellow zone. Why? If we remove our booty or shoe cover and place the foot in the red zone, what will happen? Definitely we will be contaminated our shoes, we will be contaminating our feet. So what is the purpose of wearing those PPEs if we have to contaminate it? We have to remove the booties in red zone but place our foot after removing in yellow zone. Make it clear. We don't have to drag the contamination or infect or contaminate our shoes. The second most important is the face mask, which is reusable, and goggles. We will place, because we have to wear those again, because we have mentioned that these things are reusable. If reusable, we will doff those PPEs in yellow zone, and at the end we will doff gloves and decontaminate our hands as we will move to number one is inner or first pair of gloves. You can call it inner pair of glove or you can call it the first pair of gloves. So first of all, we will don inner pair of gloves. On second point, we will wear the N95 reusable, and we will wear the goggles. Look, the N95 and goggles both are reusable. Why we are wearing the N95 before and goggles after? The reason is, when we wear the mask, we have our, this is our air loop, and then the goggles. If we wear the goggles first, then this air loop will cause some problem with this goggles. That's why first of all we are wearing the mask, and on second number we are donning our goggles. Then we will be wearing our gown, which is reusable. Then because we are considering clean to dirty, obviously our goggles or face mask will be less contaminated as compared to our overall. That's why this is the sequence: N95 goggles and gowns, and at the end we will wear our outer pair of gloves and obviously the booties. This is the sequence of donning the PPEs: inner pair of gloves, N95, goggles, gown, gloves, and our booties. This will be the sequence of donning our PPEs considering clean to dirty. Where should we wear these PPEs? The green, yellow, and red. What is meant by red? Just go? No. Red means stop. We have to wear our PPEs before going towards red. So we will be wearing the inner pair of gloves in green zone, then N95 goggles, gown in yellow zone. Very much okay now. So this is the sequence. The number one, we have to doff our booties or shoe covers. Number two, we have to doff our gloves, the outer pair or second pair of gloves. Remember, always sanitize before and after each step. First of all, we will sanitize our gloves, then we will remove our booties, sanitize our gloves, remove our outer pair of gloves, sanitize our gloves, remove our gown, sanitize our gloves, remove our goggles, sanitize the gloves, remove N95, sanitize the gloves, remove inner pair of gloves, and then we will wash or sanitize our hands. This should be the sequence from dirty to clean. Number one, booties, shoe cover. Number two, outer pair of gloves. Number three, gown. Number four, goggles. Number five, N95. And number six, at the last, is the inner pair of gloves. Remember, always sanitize your hands or gloves between each step, before and after each step. And at the end, we have to wash or sanitize our hands. So here I would like to mention another process, which is removing of the gloves. How we can safely remove our glove. This is the beaking method I will be telling you. This is developed by Sean Kaufman, which have been working with CPC. So we have our gloves. Step number one, make an L. Please repeat with me. It will be very good for you too. Make an L. L with your left hand. It should be visible like L to you. So pinch your other glove with this L. Done. Now put your finger, middle finger, make a beak, and make a beak like this one. Now this is the contaminated area of the glove, and this is the clean area of the glove, the inside of the glove. Okay? We will be removing this glove by this clean area of glove because we are touching our arm. So by beak, we will push the glove while our hand is behind the glove. This is clean glove, and here we have palm. By this way, we will remove our clean. Okay, good. This was the first removal of glove. Now this is second glove. We have beak. We will do like this. We will open our hand and it will be like this, and then we will, because this is the clean inside of glove, we will put the finger and remove the glove like this. Using this method, the beaking method, we will limit our contamination and we will make our hands very safe. we have been training many individuals, the healthcare and doctors and nurses at Pakistan. And first of all, we used to ask them how you remove your gloves. We put the glow germ on their hands, on their gloves, and they remove gloves by following their protocol. And after that, we watch in UV that there is contamination everywhere. We have germs in the hair and cuticle. So by following this method, we can avoid our contamination. This is the picking method of gloves removal. So we are done with the stage number 2, where we should remove those gloves. The booties and outer pair of gloves, which we are going to discard, should be removed in red zone. In the line, this is yellow zone, this is red zone. Here we should remove those and move our foot towards yellow zone. So then we will remove our gown and goggles in yellow zone and inner pair of gloves, decontaminate our hands or wash our hands. We will move out of the labs. So, ladies and gentlemen, only the provision or having the PPEs does not ensure that you are being or you are staying protected. The process really matters. The process of donning, the process of doffing the PPEs really matters. If we follow the SOP, if we follow the process, we will stay safe. Otherwise, it's just misuse of resources, just a waste of resources if we don't follow the process. So for donning, it's clean to dirty. For doffing, it's dirty to clean. Donning, less contaminated to more contaminated. For doffing, it's more contaminated towards less contaminated. Always follow the green, yellow, and red zones. Never mix the green and red. There should be buffer between those. The yellow zone, green should be not contaminated. The red is the contaminated or work area of the lab, and yellow is the work zone. Always follow the process. Always follow the place. Always keep what you working with where you working with. So in the end, I will like to thank RITM and the RMO office for giving me the opportunity to serve the healthcare professionals. And thank you everyone. Thank you very much for attending the session, for your time and commitment. Any questions? Ian?